Good morning, Excellencies, delegate and colleagues. It is my great honor to speak to you on behalf of Korean government to reaffirm political commitment to eliminate viral hepatitis by 2030. I'd like to thank Dr. John Ward and colleagues from Coalition for organizing today's event and also having the honor of sitting next to Dr. Harvey Alter. I very much welcome global solidarity to eliminate viral hepatitis and commitment from many countries and partners. Today, I want to share with you the Korean government commitment to eliminating viral hepatitis. In line with UN General Assembly's 78th theme of rebuilding trust, reigniting global solidarity, Korean government has implemented a multitude of policies to achieve hepatitis elimination goal. So in addition to National Immunization Program for Hepatitis B, we will further promote perinatal HBV prevention program, providing hepatitis B immunoglobulin, vaccines, and free testing to infants born to hepatitis B infected mothers to include a broader range of beneficiaries such as multicultural families and foreigners. In March this year, we announced the first national strategic plan for viral hepatitis B and C control. The primary goal of this 5-year plan is to establish a comprehensive hepatitis control system that covers all stages from prevention to diagnosis and treatment. To achieve this goal, we will expand screening for hepatitis C to early detect asymptomatic cases while establishing a follow-up management system to enhance the linkage to care for confirmed viral hepatitis cases. Korean government offers the national health screening program to all citizens, but it covers only hepatitis B screening. Now we are actively working towards incorporating hepatitis C testing into the national health screening and the linkage to care program complemented by a tracking system to ensure all individuals confirmed through the screening program receive medical care without exception. So currently we are also performing a pilot project to link hepatitis C screening to a care program targeting high-risk groups with hepatitis C, such as IV drug users and inmates of correctional facilities. And strengthening governance and collaboration at the national and global levels would be crucial in achieving hepatitis elimination goal. Republic of Korea stands ready to tirelessly work with the international community in our joint efforts for achieving the UN SDGs and WHO's goal of eliminating viral hepatitis. We are strongly committed to share our experiences and lessons learned in controlling viral hepatitis and key strategies with other member states. Looking ahead, Korean government will spare no efforts in implementing health services to achieve hepatitis elimination, ensuring universal health coverage for all. I look forward to working closely with the UN group of friends to eliminate viral hepatitis and also WHO. I also urge all of you to make concerted efforts in achieving the elimination of viral hepatitis by 2030. Thank you very much.